Hi, my name is Dr. Philip Mease. I'm a rheumatologist in Seattle, Washington, and direct the Rheumatology Research Division of the Providence Swedish Medical Center there. I'm very glad to present data from an abstract on integrated safety across all of the trials of Bimekizumab in axial spondyloarthritis and psoriatic arthritis. These were all the 2B and phase 3 studies as well. So it gives us a very comprehensive picture of patient safety and over 1,500 patients observed for up to 2 years. What we saw were relatively low rates of infection, about 1.3 or 1.4 events per 100 patient years in both the axSpA and PsA studies. We saw relatively low rates of Candida infection. This is something of interest because we know that IL-17 as a cytokine protects us from surface Candida. So there were occasional cases of thrush, for example, usually just occurring once and easily treatable with topical treatments for the most part. Only occasionally were we to see patients with recurrent episodes, more than one. So this rate was also low, and there were no systemic fungal infections noted, nor any cases of tuberculosis. Another area of interest is inflammatory bowel disease. This was seen in very low rates in the axial spondyloarthritis population, slightly more than the psoriatic arthritis population. Again, this is something that we have seen with this mechanism of IL-17 inhibition. Usually these are cases in patients who have a past history of inflammatory bowel disease and there's a flare. Occasionally we have seen some new onset cases. So this happens, the frequency is low. We do need to talk to our patients about it. Another issue that is being monitored for in current trials of psoriasis and psoriatic arthritis is the issue of depression and suicidal ideation, because these are issues that are more prevalent in a patient population with these diseases. Again, here the rates were low. There were slightly more patients in the Bimekizumab arm that reported, let me start that one again. Again, these rates were low, and I think if anything, what this reminds us to do is to talk to our patients about their mood, to talk about depression openly, and be ready to care for this issue if the patient is meaningfully depressed or has potential suicidal ideation. Another issue that is of interest, especially in a group of patients who have a proclivity to obesity, is the potential for liver transaminase changes, because sometimes if a patient has underlying fatty liver or is on methotrexate, we may see perturbations in LFTs. This was seen on occasion, so we do occasionally see upticks in liver transaminases, but these were generally transient and would return to normal, and generally did not lead to any concern about the ongoing use of Bimekizumab. Another topic of interest is that of uveitis. We know, for example, that when we use a monoclonal TNF antibody, that we can see reduction in uveitis flares, which can occur in patients with PsA or axial SpA. The rates of uveitis in this integrated safety analysis were quite low, and so it doesn't look like there's in any case a significant increase in number of cases of uveitis, and overall the rates were very low. We saw no signal for malignancy, no signal for cardiovascular disease of concern. So in general, this report underlines the relative safety and tolerability of Bimekizumab an IL-17A and F inhibitor, a dual mechanism that has been recently approved for the treatment of psoriatic arthritis and the full spectrum of axial spondyloarthritis.